Hello, I'm Jon Salmanton-García from the University Hospital of Cologne, and I will share with you some of the last results from the SALT study. In this case, cost and resource utilization patterns in surgical site infections, a pre-COVID-19 perspective from France, Germany, Spain, and the United Kingdom. These are my conflicts of interest and also the conflict of interest from the SALT study. And to begin with, I would like to provide you a bit of background on the topic. Surgical site infections are among the most common surgical acquired infections. And between these hospital or nosocomial infection, the majority of surgical site infections in Europe are due to Staphylococcus aureus. The treatment for this infection is challenging, especially if methicillin-resistant Staphylococcus aureus or MRSA is involved. The surgical site infections increased during hospitalization. They also increase death rates and treatment costs, which may depend on the depth of surgical site infection. For example, it's not the same patients with superficial infection, a deep infection, or even when an organ space is involved, and also depends on the procedure performed. The exact treatment costs may vary widely, and previous estimates from single center, hospital, or provided networks, or highly aggregated data from surveillance programs are available. These estimated average costs vary between 1,000 and 20,000 euros per Staphylococcus aureus surgical site infection case. The SALT study is a multinational, multi-center, retrospective cohort study with a nested case control analysis. The inclusion criteria are adult patients with invasive surgery performed in 2016 and with an isolation of Staphylococcus aureus. The exclusion criteria include minimal invasive biopsies, also eye surgeries, and patients with surgical site infections already at the time of the surgery in 2016. And the aim was to describe the epidemiology of Staphylococcus aureus surgical site infection in 5 European countries, as we can see in the screen. 4 centers in Germany, 5 centers in Spain, 3 in France, 1 in Italy, and another 1 in the United Kingdom. However, for the cost analysis of Staphylococcus aureus, we analyzed data from 4 European countries. Actually, the Italian center was not included in this analysis. And this is the methodology we perform, or the methodology we followed for the economical analysis. The health economic evaluation was conducted in line with a consolidated health economic evaluation reporting standards 2022, and also following the established methodology developed by the Organization for Economic Cooperation and Development, or as it is more widely known, the OECD. Cases and controls were matched by propensity score based on age, sex, status of diabetes mellitus, and the procedure duration for that procedure. And the costs were presented in euros with 2016 values. As we mentioned, United Kingdom was one of the countries, and therefore the pound sterling values were converted to euros according to the exchange rate by the European Central Bank on the 1st of January 2016. Additionally, the costs were adapted. Basically, these were the values for the respective country, and they were all set to the same proportion. The analyzed factors influencing costs were measured in 2 ways: the length in days and also the associated costs in euros. This is the general description of the sample based on the previous underlying condition before the surgical site infection. We can see the cases in blue, the controls in orange, and how there are statistically significant differences in 3 variables: the amount of peripheral vascular disease, also the number of solid tumors, and the hemiplegia. However, as we mentioned, there was a propensity score matching, and therefore all these differences were waived. To begin with, the treatment costs of surgical site infection due to Staphylococcus aureus, we can see always in the left side, the surgical site infection, and immediately in the right, the non-surgical site infection controls. And we can observe how there were statistically significant differences between cases and controls in three aspects. The first one, the overall costs, which were higher for surgical site infection patients. Also, post-operative hospitalization, the same tendency, higher costs in surgical site infection patients. And finally, the costs regarding the readmission within 1 year after surgery. Again, higher costs in surgical site infection patients. Another comparison we did was a comparison per country. And here we can see how are the values represented for France, Germany, Spain, and the United Kingdom based on these three variables we mentioned in the slide before. And in the three of them, there were statistically significant differences per country, always following the same pattern. The highest costs were observed in Spain, afterwards in France, then in Germany, and finally the lowest costs were observed in the United Kingdom. And additionally, we performed one more test, and we wanted to know which are the most important cost drivers. And as you can see in the table, there were three, the main costs. And these were driven by the need of post-operative hospitalization after the surgical site infection. Also, if this hospitalization or if there was a hospitalization in the intensive care unit, and finally, if there was a readmission within the first year after surgery, the costs were significantly increased. And we also set some outlook or like some ideas on what can we do next. The first thing is that an early detection and timely management of surgical site infections due to Staphylococcus aureus is necessary, and this could yield to a reduced hospitalization and associated costs. For that, evidence-based infection control measures are necessary. For example, preoperative colonization screening, also aseptic techniques employment during surgery, or the appropriate antibiotic prophylaxis administration. And in the outlook, we have for further analysis, the consideration and inclusion of drug administration costs. Also, we could need to consider changes during and after COVID-19 pandemic, the current inflation crisis at least in Europe, and also the antimicrobial stewardship programs. And with all this, we can conclude the following aspects. The first thing is that the severity and healthcare costs do have an impact on Staphylococcus aureus surgical site infection. And this is underscored by higher hospitalization rates, also the ICU admissions, and finally, hospital readmissions. There is a need of implementation of evidence-based infection control measures with promotion of early detection, improvement of the patient care, and finally, optimization of the resource utilization. And the next steps must come from the performance of longitudinal study with comprehensive data, enhancement of the understanding, a direct targeted intervention against surgical site infection due to Staphylococcus aureus, also optimization of healthcare resources, improvement of the patient care, and finally, enhancement of economic outcomes. And last but not least, I would like to acknowledge all the participants in this study from the respective hospitals and institutions. Thank you very much, and see you next time.